Our next story takes us to the Grand Prairie and District SPCA to learn more about their Animal Recovery Fund.
ARF stands for the Animal Recovery Fund. We started about 1 year ago, and this is to help the animals that come into the shelter that need a little bit of extra help medically. And that help could range from orthopedic surgeries to eye issues, anything where we normally would be unable to help due to the expense. The fund comes from members of the public, and we slowly develop that over time by promoting the fund out in the community.
One of the recipients of the ARF donations was Sabrina.
Sabrina is our latest ARF recipient, and she came in early July or late July, and she had a major skin problem. At the time we were thinking either a caustic chemical burn or possibly a fan belt injury, all to pretty much her whole side of one body as well as her pads of her paws, and she lost a good part of that superficial skin, but she needed daily bathing, antibiotics, and she had 2 separate surgeries to move her into acceptable, adoptable state. So I have varying pictures showing her progress, and she was actually adopted yesterday, so we're all thrilled. So this is Wolfie. Wolfie was one of our early first recipients. He came in with an eye injury, and our clinic donated the surgery through ARF, and he was actually adopted out to a fellow who lives in Chetwynd, and we've seen Wolfie on a couple of occasions, and he's a pretty special fellow. This is Hipster. Hipster came in with multiple problems. She ended up having to need 2 surgeries, one for emergency spay, and the second surgery required her to, she ended up losing her hind leg through a multiple fracture injury. She was actually here for about 4 months and was adopted last week. And this is our girl Sabrina, progressing to when she first came in, and her progress further along with the daily bathing. We got to know her pretty well. She was quite a young kitten. And this is her picture. It was taken just before she was adopted. And this is Raphael. He's one of our early dogs that was gone through ARF, and he was a young puppy, quite a neat little dog, but grew up to be about 80 pounds. When he was pretty young, he had to have eye surgery on both his eyes. His eyelids were actually turned in, and his eyelashes were rubbing on his eyes. So we had to have some cosmetic surgery to have that repaired. Most dogs, when they have those sutures removed, need to be sedated, but in his case, he laid down, and we were all quite impressed.
To learn more about ARF, you can visit www.gpspca.com or call 780-538-4030.